So this application can be used in your bed at home, and the benefit is that as Tracy's elevating her arm, she's really not elevating against gravity, which is more difficult for the muscles to produce. So she could do a higher level of repetitions in this arrangement. The height of the tool is such that her forearm is level, and just essentially her elbow is even with her shoulder. And so the arc of motion is across the plane of the floor, okay? Now the tendency is sometimes for persons in this position to tense their neck. And so to help a person relax, what you want to make sure you do is have a combination of a sufficient pillow. So just like it was difficult for her to relax her arm earlier in standing, in this position it's hard to relax the neck sometimes. So make sure the pillow supports your head, and then Tracy, if you just very lightly touch your forehead with your non-involved hand, sometimes just lightly touching the head gives the neck an external support and just teaches the neck muscles how to relax that much more. And when you're doing that, then just remind yourself to support your breathing, okay? Does that feel different?
Yeah, that's good.
Okay, good. So then remind yourself to let the tool hold the weight of your arm right in that cone of your palm. So just let it settle in there, good. And then now just float like you're just floating across the floor, the plane of the floor, but floating on air. And such that you can position the base such that as she's going forward, it actually becomes that support of the arc of movement. Now I'm going to remove my hands, but in the clinic for therapists, oftentimes the torso, the ribs become tight. So this combination of my hands and her motion are such that you can open up those ribs, and that helps to support breathing. And so involve the patient in recognizing that. So Tracy, I'll just have you breathe into my hand. Just easy, not aggressive, just letting it be full. And then combining that with the shoulder blade. So ribs and shoulder blade, and then back out into the arm. And that makes a tremendous difference. So when she goes home, Tracy, you want to just remember that support of just recognizing, just like in standing where your left leg was supporting the reach, in this position, your left hip and torso can still support the reach. Now she could also remind herself periodically of the movement that we talked about on her back, where she can punch forward with a straight elbow. So just keeping your elbow straight and then just back and forth. Okay, there you go, good. So now you can, this seems to be more of an arc of motion that you can actually feel that translation of your shoulder blade moving across your body. Can you feel how much movement is there?
Yes.
Okay, so then stay forward. Now you can reach from there. Now you can bend your elbow. So you just multiple ways of recruiting necessary muscles and then placing it into function. And that's where the tool, if it's set up right and the patient is appropriately guided in the use of the tool, then it becomes what a tool is supposed to be, an assist. In this case, the assist of healing motion.